My name is David Gilad. I'm a pediatric resident in Safra Children's Hospital in Sheba. For the pediatric hospital, we are using MetaVision in the NICU, neonatal intensive care, as well as the preemie ward, and also pediatric critical care and cardiac critical care. I think the strongest clinical benefit for MetaVision is the layout and how all the data on the patient is laid out in a very clear way. You can go very quickly from a spreadsheet to seeing lists and having everything organized by systems that is easily managed and easy to understand and to get the important information you need. I think the medication order module is specific enough for us to write complex orders for drips and for different concentrations of drips, even for from very small premature infants to larger teenagers, which require different concentrations and a lot of specific pharmacy attention. And I think the task list for having a common grounds with the nursing team for what are the tasks that need to be done, whether it's taking labs, doing routine care, and giving medication, performing orders, and all of that is very organized. So it's very clear to me as a physician who is part of the team when something is supposed to happen, and I'm on the same page with the nurse who's in charge. So it facilitates this kind of closed loop communication within the team, which is very important. I think the added value is mainly for complex cases where you need to aggregate all the data from vital signs together with the respirator and the orders and the labs and the imaging and the consults, and have all of that together and have a place to also document everything that is going on and do the charting that we need to do. I love the ease of use. I like that there's you can customize it to our daily work, and that, for example, for us in the NICU and the PICU are different departments who use different iterations of the same system. So when I'm working in the NICU as a resident, there is this one set of medications and concerns that I need to address, and for the PICU that could be different. And the user interface is different enough that I could have a button for a specific medication. I could just click it and go in one place, and this really saves a lot of time, because in a busy unit where we have to do a lot of medication orders, a lot of charting and input a lot of data, then we have all of that in a snapshot. You have this kind of dashboard of buttons, and you could just click your cardiovascular medications, and then within 2 clicks you have the order ready for that specific patient, and it prevents errors from less experienced practitioners like residents like myself.